Hello, I'm Dr. Craig Escude, president of Intellectability, formerly known as Health Risk Screening. Welcome to Medical Monday. Let's talk a little bit about the COVID vaccines. We have heard a lot about vaccines recently. There's a lot of information out there, and there's a lot of misinformation out there. I will say, as a healthcare provider, I have concerns and thoughts about all of these things as well too. One of the things that's really important to me is in using any type of medication or vaccine is that something's been well studied and that we have good data to show that it not only works, but that it's also safe. And that's a little bit challenging when we try to put something like this COVID vaccine out very quickly. Well, I've done as much research as I can at the present time to learn as much as I can about this, and I want to share some of the things that I've learned and that I believe about the COVID vaccine as a physician. First, we know that COVID, especially in people with disabilities, which we know that they have a higher chance of death if they get COVID. So we know that COVID has some significant risks to it, not only death, but the more we go on, the more we are learning that that there are long-term effects. There are lung problems, there are risks of blood clots, there are risks of heart disease associated with COVID after the initial infection has already occurred. So, we look at an increased risk of death, we look at an increased chance of long-term effects, and we realize, we've got to do something to try to prevent this to the best of our abilities. And that's what was done. They really fast-tracked the development of vaccines. Now, one of the things that I've learned is that they really, when we look at fast-tracking the vaccines, the concern is that, well, they didn't study it well. Well, what they did do is they did do the studies, the same types of studies that would have been done for any vaccine in any other situation. But the reason they were able to get it out as fast as they did, or one of the reasons, is because there's a lot more money put into it, and there was a big reduction in the amount of red tape and paperwork and those types of processes that needed to occur. So the vaccine has been well studied. Now, with that, it is a newer technology. There are different types of vaccines, and new ones are coming out all the time. But one of the technologies that we know about is the messenger mRNA. That's in a couple of the vaccines that we have out now, the Pfizer and the Moderna vaccine, which are the first two that were approved in the United States. And we know that a number of people have gotten those. And so far, there's no sign of long-term effects. And we say long-term, of course, we haven't had it out that long. That's something to think about. But in most things in the past, and especially in vaccines, long-term effects are usually seen within the first 2 to 3 months after a vaccine. And we have had people who have had it for that long, large numbers of people who have had it for that long. But I do know that they're going to continue to monitor for any effects and watch very carefully should there be any long-term effects that do appear. So as far as safety, I think with the length of time it's been out, I'm pretty well reassured that this is a pretty safe vaccine to get, and it's important. And when you compare the risks of the arm pain, the local effects, the fever, stuff like that, with the risks of someone getting COVID, especially if they're in a higher risk category, in my mind, it's a no-brainer that we should be getting the vaccine, especially if you're in a higher risk category. We know that the initial vaccines are 94-95% effective. Again, there are newer ones coming out that work differently than the messenger RNA. They seem to be a little less efficacious in terms of completely preventing it, but still very efficacious in preventing serious disease and hospitalization. So that's some good information to know. Now, when we're talking about the vaccines in terms of people with intellectual and developmental disabilities, we know that people with disabilities often present differently. They may not have the same way of expressing side effects from a vaccine. So one of the things that we've done at Intellectability is we've created a document that we call the COVID-19 vaccination document, facts for you and people with disabilities you support. And so the informational document starts off with just some very basic facts, but it goes into some details about how certain common side effects might look differently in people with disabilities. For instance, we might feel tired, or the person with disabilities might feel tired, and instead of being able to say, gosh, I feel really tired, I want to lay down, they may simply not show interest in their usual activities. They may not want to eat or drink. They may not act like their typical selves. They may want to sleep more than usual. So that might be a sign that they're feeling tired or fatigued from the vaccine. Muscle pain, joint pain, sometimes that may present as a person being irritable, striking out at others or striking out at themselves, maybe wanting to sleep more or hitting that area. Sometimes a person might hit the area of pain, almost trying to beat the pain out of it. So if you see these things, it could be an indication that they're in pain. Fever might look like a decreased appetite, loss of interest in activities, maybe wanting to remain covered up in bed. Nausea or vomiting often presents with signs of refusing to eat or drink, or maybe even resistance to going to the location where meals are served. They may not want to even go sit at the kitchen table, and they might become agitated because of that. And that could not, that may be because they're experiencing nausea as a side effect. So these are just some of the different ways that people with disabilities might present. There are some things you should check on if you're a person who works with people with disabilities. Look for fever, elevated pulse, shaking and chills, these changes in eating and drinking patterns that I mentioned, a change in either self-abusive behavior or aggression towards others, hitting or rubbing at the injection site, not wanting to use the arm where the injection was administered, and really any change in a person's baseline. And you should monitor for those signs and symptoms at least twice a day for the first 72 hours after a person gets an injection, gets a COVID vaccine injection, and notify the nurse or the person's healthcare provider right away. If you'd like to grab this form and use it, it's freely available on our website at replacingrisk.com on the COVID-19 resources webpage.
Hey everybody, thanks for checking out this episode of Medical Mondays with Dr. Craig Escude. We'll be back next week with a brand new episode and a brand new topic. So make sure to go down below and hit that subscribe button. We're also working on some new episodes for you guys, as well as putting out the podcast every week. So thank you all for watching, and we will see you next time.